Hello, everyone. My name is Ria Chatterjee, and welcome to our podcast, Doc's Orders. In this podcast, we ask medical professionals questions that you are thinking. Today's episode, I have the pleasure of interviewing Dr. Delgado, who's a gynecologist who's focused on helping women of all ages. How are you today?
Hi, I'm doing well. Thank you for having me on your podcast.
So, can you describe your job to our audience?
Yeah, I was trained as OBGYN and I am a gynecologist specializing in chronic pelvic pain, which means I specialize in women's health, particularly women who experience painful cycles and pelvic pain and sort of chronic GYN issues.
Yeah, I think that's a really important field to get into. So, if one person would take this path, say for your job, how can you describe the path that you took to get your job?
Yeah, I did take a little digression in my path. Some people go straight through. So I did college at Lehigh University, and then I took a gap year, which wasn't very popular when I did that. But I spent time kind of figuring out what I wanted to do. And then I wound up doing a post-baccalaureate program at Columbia from New York originally. So that was close to my home. And then I decided to go to medical school in Mexico at UAG after not able to secure a spot the first time around. So I did some research and a couple of my friends had gone there. So that was a non-traditional path, but it was an amazing experience. And to segue back into the United States, we do something called a fifth pathway program. And so I went to New York Medical College through that program. And then I did my residency in Newport News at Riverside Regional Medical Center. So that's how I came to Virginia. And I stayed, and originally I worked as an OBGYN and I did a ton of OB in the first 5 years out of residency. And then I decided that I really wanted to open up my own practice. And I did that in the capacity of general GYN while I did OB hospice work. And I delivered as an OB hospice until my twins were born around 7 years ago. And then after that, I pivoted my practice again and I narrowed my niche and focused specifically on chronic pelvic pain.
I think that's really cool how you went down all these roads and you made your way here in like a really cool way, and you're doing great at your job. And so, at what age should people start going to the gynecologist?
I get asked this all the time. I think the short answer is it depends where you live and what your general pediatrician is comfortable, what age they're comfortable working with. There's also an interim specialist that came about, which is for adolescent GYN, pediatric GYN for adolescents. And I think they manage from birth all the way up to about 23. And then general gynecologists are more than happy to see girls as early as, I think, 10, 11, 12, pre-menarche. And then once they have their first cycle, and anytime they have questions and concerns, and there are some, issues that women have younger that pediatricians feel comfortable that the gynecologist just takes over at that point in time. So I think if you have specific concerns or something is not going the way you would like to, or you're not getting the answers, so is always recommended.
Okay, so speaking of specific concerns, so what are some common reasons on why people see a gynecologist? Or
Yeah, so more commonly, I see people because they have pain with their menstrual cycle or painful cycles. They also have pain with intercourse. That's a common complaint that I see. I also see people with chronic conditions. So if they've had frequent UTIs that haven't been addressed or treated to their satisfaction, chronic vaginal infections, which now overlap with gastrointestinal concerns and all of those together are considered chronic pelvic pain and some pelvic floor dysfunction. And then I am a robotic surgeon that exclusively operates for endometriosis. So people come to me for surgery. And then I do some general things like contraception, IUD placement. I do some general GYN that overlaps and intersects with some of the more chronic issues that I see.
It's really cool. So, what are some of the things that you should expect from your first visit?
So I differ a little bit from the first visit that some people think of traditional going to a gynecologist. So in general, my patients will expect to see me for about an hour, and they get to tell me their entire pain journey. And then we can discuss whether or not we're going to do an exam at that time, and then maybe start treatment. And then we come up with a therapeutic plan that's suitable to their lifestyle and their liking. And I do a lot of holistic interventions as well. So I do more natural, and then I, can scale up to all the way up to surgery. For general GYN, for like an annual exam, for example, you're going to meet the physician, you'll talk to them, and then, exam, a pelvic exam, and a pap smear, and then STD, STI testing. So that's the general annual exam. It's not an hour. It's about 15, 20 minutes. So I don't want to scare any of your podcast listeners that everything's going to be an hour. It's a short exam, and it's focused on your general concerns.
Yeah, and I really like how it was focused on like the patient, and then, like, because I've heard a lot of my friends who are who are very scared to go to the gynecologist for the first time, and they're all often like, because they don't know if it's going to take like I heard one of my friends thought it took like 2 hours, but yeah, so there's a lot of misconceptions, so thank you for clearing that up. So
Yeah, and yeah, go ahead.
oh no, you go ahead first.
I was just going to say, to be clear, you don't necessarily need a pap smear until you're 21 or sexually active. So to see a gynecologist, they're not mutually exclusive. You can go there to talk about any kind of abnormal discharge, abnormal bleeding, for contraception, just to kind of meet and greet and get to know them. And there may not be a physical exam that's involved. So not everybody needs to have a pap smear and a speculum exam on that first visit, just so your listeners understand that too. And
Yeah.
don't be scared of us.
So you mentioned earlier that you help people with pelvic pain. So what are some positions that might relieve some pelvic pain?
I think yoga and physical therapists really put on the map for us, at least for physicians in my position, where we want to help, but we don't really know what would be working. And so I turned to my yoga therapist, because there are really a nice positions that really help with pelvic pain. And you can look up some of the poses, and they have YouTube videos now and all these cool things, but happy baby tends to work really well. Child's pose, legs up the wall, is a really restorative, nice pose for a lot of women. And you don't have to do like intense exercise and activity to feel better. Just walking, movement, mindful movement is enough. And sometimes when you're in pain, you can't really rally to go do like a Peloton workout or something like that. So it's really nice to know that you can lean on the physical therapist, do some gentle yoga poses that will really help with pain. And the more the body moves, the better you feel. It's just sometimes you can't get to the point where you can actually move your body that way. So just walking, sometimes I recommend to many patients, as long as they do it consistently, is better than just doing it for the weekend for an hour on a hike. Let's say if they do 20 minutes a day, it's more impactful to their overall health and quality of life.
I really like how easy it is to like relieve pelvic pain, because I didn't know that it was as simple as walking. I genuinely didn't know that. So what are so moving away from pelvic pain out, so what are some contraceptive options that are available, and what are their contraindications?
Yeah, so this is a great topic to talk about for anybody. I get this question all the time, pain or no pain. So usually we think of hormonal contraception, non-hormonal, and then fertility awareness methods. So most women are aware of the pill. That's the most common version. It's both estrogen and progesterone, and you have to take it once a day. And uh, that's just generally accepted because it's an easy thing to start and stop. And so if you don't like it, then you just stop it. Then the pill can also be progesterone only for women who don't want to do estrogen or cannot do estrogen. And then there's various forms of combined, like a patch, a ring, a vaginal ring. You can do injection, there's an implantable rod, and then IUD. And so the IUD is interesting because it's different from the IUDs in the 50s, where it was really difficult to remove. So everything's silicone based, it's really nice. And there's two forms. There's hormonal, which is progesterone only, and there's non-hormonal, which is copper. And so that works really well for girls or women who just don't want any hormone in their body. And it's useful because it can work for up to 10 years and you can remove it whenever you feel like it. Other non-hormonal, you guys know as barrier or condoms, spermicides, which you can get in any pharmacy, and then the fertility awareness methods that are becoming, I think, more popularized. I hear more women asking about it, which would be things like tracking ovulation. There are apps to help you now to figure out when you should be getting your cycle, when you should be ovulating. So you can use them both ways. When you want to get pregnant, you've intercourse during your time of ovulation. When you don't want to get pregnant, you avoid intercourse that week. And then you can kind of predict when to have intercourse and when to avoid it. And so some people like that. A lot of people are relying on cervical mucus techniques, basal body temperature. So those are some of the things that women are really relying on now, both to prevent pregnancy and achieve pregnancy. And the contraindications mostly revolves around the hormonal contraceptions. So for estrogen, that's the biggest part. So if you've had a history of cancer, we tend not to like to do that. It's hard when girls are young and we don't have a lot of information on their history or family history, if they have a bleeding disorder or have had a previous blood clot. And that's one of the risks of being on combined contraception, is that you can develop a blood clot, and it does happen. And then moving forward, you probably should be avoiding any kind of estrogen therapy, including hormone replacement therapy, as we get older and we age into menopause, that kind of thing. So those are liver disease, things of that nature are the most common contraindications. And so, it's one of those things where the benefit of seeing a gynecologist, talking about your history, or even a pediatrician or an adolescent GYN, where they know the risk, benefits, and alternatives. And then you can come up with like the best plan that is in alignment with your philosophy moving forward.
So what do you suggest to people if they are pregnant?
So if you find out that you're pregnant, seeking guidance from a medical professional, like I've mentioned, whether it's a generalist to get into initially, your pediatrician, an adolescent GYN, OBGYN, Planned Parenthood, places like that, is really important, because I think sometimes you don't realize how far along you are if you are pregnant. If you don't realize you've skipped a couple of cycles, you could be further along than you think. And then going through all of your options is really important to get an informed decision. To your point, you don't want to rely on misinformation by your friends, family members, Google, TikTok videos, these kinds of things. You want to be able to figure out what exactly your options are, how far along you are, to make any kind of decision first. And so we need some blood work to figure that out.
Yeah, no, I think I like how you talked about misinformation, because I know in my elementary school we didn't talk much about not even just in elementary school, but like even now, we don't talk much about like what to do if you are pregnant. And another thing we didn't talk about was discharge. So can you talk more about discharge and what the different colors might indicate?
Yeah, and I feel like we should know, right? I mean, it's our bodies and we just don't. And so it is a good platform to talk about what's normal, what's not normal. And I get this all the time from all ages. So don't feel bad if you're not up to date with this information. It's just not discussed, like you said. With clear discharge, that's considered kind of quote unquote normal discharge. It's a healthy version of your discharge, and it changes with ovulation and pregnancy. And so that's something to be familiar with your own body. Some women just have more discharge than others. It doesn't mean it's abnormal. It just means you have more discharge as long as it's clear and it's almost like an egg white consistency, or it's thinner than that, depending on where your hormonal status is. When it becomes abnormal, and what you want to note is if it becomes grayish in color with maybe a little bit of odor, more like a fishy odor, that tends to be indicative of a bacterial infection called BV or bacterial vaginosis. A yellowish green discharge we tend to lump with trichomonas in terms of a sexually transmitted infection or an STI. White and itchy, clumpy, thickish tends to be a yeast infection. Itching is probably the most irritative of that. If it's a pinkish red and you're not on your cycle, it could be irritation of the cervix, an infection that isn't like trick. It could be a polyp or something benign. So those are things where you want to have a professional take a look and try to avoid putting it off based on fear, because some of these things are easily taken care of and it's not always as scary as you think. But if you can't always tell if you have chlamydia, gonorrhea, you might not have a change in your discharge, right? It's asymptomatic, and we pick that up on a very simple vaginal swab, and it's treatable, right?
Yeah, I know. I understand, like not many people talk about things like discharge. Many people meant to talk about periods, but no one really talks about the other stuff. So what are some myths that affect your patients and your job?
Yeah, so I think some of the things we've alluded to is like, well, I don't really have to go to an OBGYN because I don't really have a problem. But I think if you're not feeling that you're getting accurate information or information at all, it's really good to go and say, hey, when do I need to think about birth control? When is discharge abnormal? Like, I'm feeling this way about my body. When can I expect X, Y, and Z? And that's what we're here for. We're here to talk about transitional time frames. Women come to see us when we're menopausal and they want to know what to expect and what to do, how to prevent, what can they do to support themselves. Same thing with adolescents transitioning as well. It's not just when you have this urgent problem that you want to come see us. The other thing is that you have to wait until you get your cycle or your period to come see your GYN. That's another kind of misconception that I've heard from younger patients. Are like, oh, I would have seen you sooner. I didn't know that I could come see you. So absolutely you can. And then, a lot of women think you need a pap smear to have testing for any kind of infection. So the two aren't mutually exclusive. You can get a pap smear if you want to, and that's really an evaluation for cervical cancer, right? The pap smear is a detection tool. So we want to know your HPV status and the cellular abnormality as it relates to cervical cancer. A sexually transmitted infection is different, and you don't need a pap smear for a vaginal swab. Now, we may use a speculum, but that doesn't mean you need to have a pap smear done. So I think that's another misconception. The other one is that you don't need to see an OBGYN every year, and that kind of goes by the guidelines that you may not need a pap smear every single year, but you should have some kind of annual exam every year. So if you're not seeing your pediatrician, you should be seeing some kind of gynecologist or an adolescent gynecologist, whatever you feel comfortable with. And then you need to be 21 or older to see an OBGYN. Again, I think that's a big thing too, is that there's an age limit or an age restriction coming in as a barrier to see a gynecologist. So I hope everyone feels that they're able to engage with a gynecologist whenever they feel like they're ready.
Yeah, yeah, no, I really like what you said. So so I'm gonna ask, so okay. I've always seen those like not just on Instagram, like Pinterest being like foods to eat when you're on your period. But is it true that like certain foods can improve vaginal health?
So that holistic side in my brain, there's a link, right? We are what we eat. Everything impacts us, especially from a GI perspective. So if our gut is healthy, we make really good hormones, and impacts our cerebral health and our vaginal health as well. So it's really about healthy microbiome and the balance that creates. So we have bacteria and yeast and or fungi and viruses that just kind of live within us, right? And so I think your listeners will understand this in terms of pre and probiotics have been popularized because of this concept. So the one most important group of bacteria that we like to see for vaginal health is lactobacillus. And you see that in a lot of yogurt or probiotic strains saying, oh, it has whatever, however many billion lactobacilli. And that's because that maintains GI health, vaginal health, and anything with a microbiome. So foods that promote this probiotic, where these healthy bacteria like to eat, are foods like yogurt, coconut yogurt, especially because it's fermented, like any fermented foods like sauerkraut, kimchi, kombucha, things like that. But we also know eating foods rich in fiber and zinc, and specifically vitamins A, E, and C, that's where you see those blogs around, oh, if you eat foods like, yams or pineapple, they're rich in these vitamins, which will then lead to or promote a healthy balance. So in some ways that's true, but you also have to take everything into consideration. And all about the delicate balance. It's an ecosystem that we have in our vagina. So if you can leverage that and sort of prevent imbalances in your microflora, then you're preventing things like abnormal discharge and things like yeast or BV, because they're growing out of proportion because your microbiome isn't balanced. Does that make sense?
Yeah, no, that definitely makes sense. I like what you said about yogurt, and that actually leads us to our next question, because this is like a huge rumor that I've heard, but is it myth or fact? Can yogurt cure a yeast infection?
So I think yogurt helps support the balance that's the delicate balance that is our vaginal ecosystem. So I know there are many herbalists and naturopaths that claim yogurt douching will help with yeast infections. I think it brings everything back into balance. I think it depends what kind of yogurt you use, how you use it. And currently, at this point, there's so many other ways to help treat yeast infections on the market that will maintain vaginal health. Like you can just eat yogurt or an oral probiotic. We do vaginal probiotics as well. But I mean, I feel like there are enough women who say yogurt douching has helped. I'm just not a fan of douching in general because I think it offsets the balance. So curing, I think it helps offset or reduce the symptoms as it may relate to yeast. So I've seen both sides, and I don't want to say that that doesn't work. I just prefer to use, or I recommend other options, but before I get to yogurt douching. Does that make sense?
Yeah, that definitely makes sense. So, speaking of douching, do you recommend vaginal cleansers that are on the market?
I'm personally not a fan of douching because it I feel like it disrupts the microbiome balance, especially when you're using like scented cleansers and soaps, and some of these douching solutions have a lot of chemicals in them, scented tampons as well. So, I mean, there are some people who say they use like an apple cider vinegar rinse and things of that nature, but really, the vaginal ecosystem is set up to be a self-cleansing environment, and if we can support it and bring it back into balance, douching often is not necessary.
So, going back to like yeast infections and stuff, so can you explain what a yeast infection is and how to identify it?
Yeah, so yeast is very common. So I feel like, one, don't be embarrassed or withhold some of these symptoms for a long period of time, because I see young girls just say they've had noticed discharge or itching for months before they come in. So the sooner the better. And it's just an imbalance in the vaginal flora, really, and a change in pH, and you get an overgrowth of these Candida species. And a lot of times it can help. A lot of times what causes the delicate pH balance change is just your menstrual cycle. So a lot of women tell me they have like itching or worse discharge after their cycle. And that's very common because you don't have enough good flora to offset the change in the pH when you do have a menstrual cycle, right? And so most commonly what we see clinically is a thick white vaginal discharge that you experience as being intensely itchy. And so these are easily identified. If you come into the office, we can take a swab. We can even identify some of the Candida species. And like I mentioned earlier, you can do a more natural type of treatment with probiotics, vaginally or orally. But really, there's a medication that you can take orally and or vaginally that takes care of the infection and decreases the amount of Candida, so that the symptoms get resolved.
So speaking about infections, so what infections or diseases do you deal with most often?
Yeah, so all the infections that we mentioned before, like BV and yeast, and trichomonas, which is sexually transmitted, but non-sexually transmitted infections, when they become chronic or they just don't get better, and some women flip between getting a yeast infection, then you treat the yeast infection, then they get BV, then you treat that, then a couple of weeks later they have another yeast infection. It's just all about controlling that microbiome. And so that's something that I deal with a lot. I deal with women with painful cycles, like I mentioned earlier, and the term for that is endometriosis. I deal with chronic bladder infections called painful bladder syndrome or interstitial cystitis. And then that overlapped with the leaky gut IBS spectrum of GI disease, which again is all about the microbiome. And then a lot of these women have pain of their vulva and their pelvic floor, which means intercourse is very uncomfortable. So another reason why I see women come to see me is that they're not able to have painful intercourse anymore, and it's disrupting their quality of life.
So moving away from actually staying on the topic of infections, moving to a very different infection. How has the pandemic has affected each job in a different way? I was just wondering, how has the pandemic affected your job specifically?
So I was very lucky to pivot during this pandemic because I was able to see a great deal of patients via telemedicine. So I was able to continue to conduct consults, just like what we're doing here, without necessarily doing a physical exam, but I can get their history and we can talk through some treatment options and therapeutic options with minimal contact in the office. And then I used to run my practice where we decreased the amount of patients that I saw. And then I did alternating. At that time, I had 2 nurse practitioners working with me. So we would alternate weeks who was in the office and who was home. So I would take telemedicine visits at home while someone was in the office, and then we'd swap so that we just had one provider and one nurse and a front office person at any one time in the office. So if a team got sick, it would be replaced with the like team B, if you will.
That's a really good idea. I know a lot of the pandemic has affected different professions in different ways. And so speaking about like your profession, there's a trend on TikTok where you mention like 5 things you would advise someone not to do. Can you come up with 5
Yes.
things you would strongly advise members of our audience to not do?
Yes. I hate using the word never. So I like that you say things that I would not do. So I would not ignore persistent itching, burning, or a malodorous vaginal discharge for everything that we mentioned today in this podcast. So vaginal health is really important. And to your point, it's not always discussed openly. So I think that's really, and then there's shame behind it because someone's like, oh, what's wrong with me? I have this odor. So it can be easily fixed. That's one of the things I would love women to know. I would not use scented wipes or vaginal cleansers. That just irritates the vulva and the skin of the vulva, and also disrupts the microbiome that we talked about. Another one, I know a lot of women are using Diva cups and things like that, but leaving tampons in for more than 8 hours is something that I wouldn't do. I think you have to remember when you place them and remove them. We do often see retained tampons for some people, and then toxic shock syndrome I haven't seen a lot of, but it exists still. So that's something to be mindful of. I would not ignore irregular vaginal bleeding because it could be something super easy and benign, or it could be something more important that we need to take care of. And then after you poop, always wipe from back to front. I think some women forget that. And when we're teaching our young kids, I think that's something important to remember.
Yeah, I just heard about the back to front thing. I didn't know that was a really big thing. But unfortunately, this is all the time we have left. Thank you so much for coming to this podcast. I hope you have a great rest of your day. To everyone who's
Thank you.
listening, yeah. So to everyone who's listening, thank you so much for listening. We really love and care your support. I hope this information can help you or a friend out. Have a great rest of your day.
Thank you so much. Take care.